to get an STI test.
Okay, great. Have we ever seen you here before?
No, this is my first time.
Okay, well, welcome.
Thank you.
I'm gonna just get you a little bit of paperwork to fill out here. All right, so this is a health history form, and you can just answer these questions to the best of your ability. If you don't know the answer to something, or if you want to talk more about it in the room, you can just leave a blank and we can talk when we have more privacy. And there is lastly a little place to sign and date and a little checkbox, and that just shows that we offered you the HIPAA privacy policy.
Perfect. Thank you so much.
You're so welcome. And there's hot water and tea in the waiting area.
Awesome. Hi Bianca, are you ready to come back? How are you doing?
Pretty good, how are you?
Good.
You all done with your paperwork there?
Yeah.
All right. Well, you can just have a seat in the waiting area. I'll call you back in just a couple minutes.
Awesome. Thank you.
You're welcome. Hey, Erica, you ready to come back? Right. So we'll be in this room today. You can have a seat in that black chair.
Awesome.
Right. Thanks for coming in today. My name's Rose, and I'm a clinic assistant here. So I'll be doing your visit today. I always just like to let all of our new clients know that everything we talk about is completely confidential. That means that we're never going to share your information without your written consent, okay? And I am what's called a mandated reporter. So that means that there are some things that I'm legally responsible for sharing to law enforcement, and that would be if you were to share with me that someone was hurting you, or if you were planning to hurt yourself or someone else, if there was any sort of sexual abuse or assault happening. Those are some things that I would have to report. Do you have any questions about that?
I don't think so.
Okay, cool. So everything else super confidential.
Sweet.
Just tell me a little bit about what brings you in today.
So I have been in a sexual relationship for a little bit now, and it's not exclusive, so I don't know who his partners might be, and I know he doesn't get STI tests, and we don't use protection.
Okay.
So I would really like to know where I stand with that and kind of just get checked up. This is my first time, so I don't really know how this works.
Okay. And are you experiencing any symptoms that have you concerned?
Not particularly, no.
Okay.
Nothing that I've noticed. I'm trying to be cautious.
Right on. Yeah, and a lot of STDs don't have symptoms,
Yeah.
so that's great that you're coming in just to check out. That's great. So, how our STD tests work is we follow some national screening guidelines, and my job is just to let you know what those guidelines are, and then you can opt into a test or you can opt out of a test. And again, everything we do here is 100% up to you. So we want you to help you make those great choices for your health. So, a recommended test for you based on your age would be a test for gonorrhea and chlamydia. And that's recommended for everyone under the age of 25. Anytime you have a new sex partner, it's also a good idea to repeat that test. Alaska has the #1 rate of chlamydia in the United States, so we see a lot of it, and that's why we recommend it for all of our clients under the age of 25. And how that is collected, for women, we can either do it through a urine sample or a vaginal swab, but it's something you do totally private. It doesn't require any sort of exam. We just give you the kit and you take it into the bathroom.
Awesome.
Does that be something you might be interested in?
That sounds really great.
Okay, great. And just so you know, I'm going to just be taking some notes for your chart.
Yeah.
It's nothing secret.
That sounds good.
Great. All right. Another nationally recommended screen would be for HIV. And it's recommended that every sexually active person has at least one baseline HIV test. And then anytime you have a new sex partner or new potential exposure, it's a good idea to follow up on that one as well.
Okay.
And we even have a rapid test that we can do here in the clinic that is just an oral swab. So some people don't even need to get their blood drawn.
That's awesome.
Would that be something you'd be interested in doing today?
Why not?
All right.
Might as well.
Next, there is a screening that we can do for hepatitis. We can screen for both hepatitis B and hepatitis C. I'm noticing on your medical history that you've had your school vaccinations. Okay, so then you were likely vaccinated against hepatitis B based on your age. Hepatitis C, however, does not have a vaccine. And the risk of sexual transmission is fairly low for hepatitis C, but we would recommend it if you or any of your sex partners have a history of IV drug use, so that is injecting drugs into your veins. If you have ever had a first aid incident where you're exposed to someone's blood or like a potential needle stick,
Right.
or if any of you or your sex partners have a history of incarceration. So that's, the prison population is at increased risk. Are you feeling like that is something you'd like to screen for today?
I don't think that I would be susceptible to that, but I mean, I'm here. What does that look like for that test? Is that another blood
Sure.
test?
So that one, we also have a rapid test here.
Okay.
And instead of doing an oral swab, we would just do a little finger stick. So I just get a couple of drops of your blood. It's kind of like when people test their blood sugar. It's just a little tiny needle.
Oh, okay.
And we get those results in 20 minutes as well.
I'm a little scared of needles, but I think I'll try that one too.
You want to try that one?
Yeah.
Okay. And the other tests that we have would be a screen for syphilis. And we recommend syphilis screening if your sex partners are men who also have sex with other men. If you or your sex partners, again, have that history of incarceration, prison population tends to be a little bit more at increased risk for that. And also any involvement in the sex industry. So it's exchanging sex for drugs, money, food, or housing. Do you feel like those are risk factors for you?
I don't think so.
Okay.
So maybe just stick with the first 3 ones?
Okay, perfect. So we've got that one for the HIV and then this one for the hepatitis C.
Awesome.
Okay? And then I will collect samples and we get those results in 20 minutes, which is great.
Perfect.
So you get to know your status today. The other kit, which I'll show you in the restroom, we get those results in about a week or so. With all of our testing, no news is good news. So we only reach out if someone tests positive. But sometimes people really just want to know what their test results are, and that's totally cool. You can give us a call or you can pop in if you have any questions about that.
Sweet.
But we will definitely reach out if anything requires any treatment.
Okay.
Okay? Cool. And then just you and your partner were saying that you don't always use condoms all the time. Are you on a birth control method?
So I'm not technically, I mean, we use the pull-out method and
Okay.
stuff like that sometimes, but like,
Okay.
it's just, no.
Yeah. Okay. Well, seem like you're probably pretty busy. You got a lot on your plate. Are there any birth control methods that you've heard about that you're interested in?
I mean, I've been thinking about possibly getting an IUD, but I'm not sure yet. I'm kind of
Okay.
scared of getting things like that in my body, just foreign objects, kind of.
Yeah.
That
And
freaks me out.
Yeah, that's a pretty common thing.
Yeah.
Well, what we can do is get you on the schedule to meet with one of our nurse practitioners.
Awesome.
They're all women, and we see both men and women here for practitioner visits, and you guys can go over all the methods that we have available and do what we call a well woman check. So that just is kind of like your annual checkup, and you can have any questions answered that you might have about your reproductive health. And for women under the age of 21, there is no physical exam indicated unless you have some symptoms.
Right.
Or if you did want to get an IUD inserted at that visit, you could go through that.
Awesome. Cool, that sounds great.
All right, so here is your sample collection kit. Here are the instructions on how you can collect it. When you're finished, you can just put your sample right inside the store. You might notice our condom buffet here. So we have tons of different styles, sizes, textures, so you and your partners can figure out which one might work best for you. And they're always free, and you can always just walk in and grab them. Okay, thanks. All right, thank you so much for coming back in. So we had a little brief conversation on the phone, but just to follow up, that chlamydia and gonorrhea test that we had you collect in the bathroom the other day did come back positive for chlamydia. Chlamydia is a very, very common STD. We see a lot of it in our community. And most of the time it doesn't have any symptoms, because it kind of sounds like you weren't experiencing any symptoms. But it's super easy to treat, which is great. So there is an antibiotic that I'm going to mix up for you to take. Have you ever had an allergic reaction to any antibiotics that you know of? Okay. Well, this one, is called azithromycin, and it's a one-time dosage. So you drink it once, and then you have to abstain for 7 days. So that's no sexual contact of any kind for 7 days. And that's just so that the antibiotic can work and make sure that it keeps you safe and any of your sex partners safe. Okay? Another piece for you to stay healthy is to also get all your sex partners treated, and any sex partners that they might have. We're happy to notify people totally confidentially and maintain your privacy, but sometimes people like to have a conversation directly with their partners. So you can definitely think about that and how it would be easiest for you to notify them. Okay?
Okay.
All right, I'm gonna go get that medicine. I'll be right back.
Thank you.
So this is the medication that we treat with for chlamydia infections, and I just mix it up with a little bit of water, and again, it's just a one-time dosage.
Awesome.
Okay?
Thank you so much.
You're so welcome.